Hello, everybody, and welcome. My name is Al Castellanos with Premier Insurance Contracts, and today we're going to continue with our process of presenting you with what we consider is the most comprehensive ACA training program in the industry. This comprehensive training includes two components. On the first component, we cover everything about products, and what we do there is we basically go over the products and the portfolio of products by the individual carriers, and we also cover their individual platforms in order to do business. On this second component, which change gears, and we have a sequence of 4 elements that cover distinct aspects of everything that you need to know in order to be very successful in your ACA venture, and additionally, for us to make sure that you become the right insurance agent. So we have a lot of material to cover, so let's get started right away. First, let me introduce our group of companies. We have Prinsuco, Premier Insurance Contracts, which is the field marketing organization. Prinsuco is the company that has all the different contracts with all the carriers. It's the company that manages the operation, and is the one that pays insurance agents when they make all these sales under the Affordable Care Act. So Premier Insurance Contracts, the website is Prinsuco, and it's the FMO. We also have the American Institute of Financial Education. The website is AINFE, and AINFE is basically an educator. What we do with AINFE is we provide continuous education to insurance agents, and our philosophy there is to make sure that we provide you with continuous education that actually educates you. So not only do you satisfy the requirements associated with maintaining your insurance licenses, but also continuous education that makes you a better insurance agent. And finally, we have the American Institute of Digital Marketing. The website is AMIDIM, and basically AMIDIM is an educator in digital marketing. What we do under the AMIDIM banner is that we provide you with education on how to use digital marketing in order to generate new business and in order to enhance your practice. So these are the 3 companies: Premier Insurance Contracts, the FMO, the American Institute of Financial Education, Continuous Education Educator, and the American Institute of Digital Marketing. It's a digital marketing educator. We will be inviting you to upcoming events under each one of these different companies. And keep in mind that everything we do under any one of these companies is directly associated to making you a better insurance agent. The presenter, myself, Al Castellanos. I'm a licensed insurance agent. I have been licensed for 24 years now. I'm a CFP, a certified financial planner. I've been a CFP for 14 years now. I have a master's in financial planning, a master's in financial analysis, and I completed my PhD studies in personal financial planning. Everything that has to do with the training process that we put in place, I have developed, and I have used all my experience over 38 years doing this in order to make sure that we provide you with the right mix of elements and topics in this training session to, again, make sure that you are properly organized and properly trained in order to be a successful ACA agent. Additionally, with me, although I'm the presenter, we have a group of ACA experts with us that will be answering your questions. I want to use this time to get you acquainted with a GoToWebinar tool. There is a questions tab on the upper right-hand side of your screen, and you can ask questions through that tab, and that's how we're going to communicate. Again, we will be answering questions as we go through the presentation, and if there is something that we cannot answer right away, what we will do is make sure you, in your questions, include your email address, and we will answer to you as soon as we have the response to your question. The ACA 2024 training series, this second element that I was talking about, includes 4 sessions. Session number 1, which we're going to be covering today, is the introduction to ACA health insurance, and we're going to also cover elements associated with you being certified, either if you are a new agent or a returning agent. In section number 2, we're going to be covering Enhanced Direct Enrollment Platform and Health Sherpa, which is the platform that we use. So we're going to be immersing ourselves in session number 2 in everything that has to do with the enrollment platform and how you can use it as a CRM system to cover all aspects of your business. Session number 3 is going to be all about digital marketing. There we will cover a proprietary concept that we have developed that is called a mashup, which is a very specific strategy in order to implement digital marketing. And we will immerse ourselves into all the content that some of the most important carriers in the country have created for you, the insurance agent. So we'll see how to get to that content, and through the mashup strategy, how to put in place all that marketing in order to increase your business. And in session number 4, it's all about money. Here we will cover how to manage your business. We have organized, and we have been using for the last 4 to 5 years, this monthly audit, which is a very, very effective way for you to make sure that you know exactly what's happening with your business and what happens when they take one of your clients away from you. This monthly audit will help you identify those situations and initially file a claim about that. And also we will cover the new attestation forms, which we strongly believe they are a game changer, and they're giving us additional tools in order for us to be able to keep our business. So those are the 4 sessions. And again, as I mentioned before, we're going to get started with session number 1, Introduction to the ACA Health Insurance. I want to start by looking at some of the numbers associated with the enrollment in the ACA marketplace. And if you recall, for those of you who were with us back in 2014, and again, this is for the United States, this is for the whole country, but basically on the first year, there were a total of around 8 million individuals that enrolled into an ACA plan through the marketplace, and that went up all the way to around 12.6 million, and then it plateaued. It plateaued for several years, 1, 2, 3, 4, 5, for 6 years. It plateaued around 12 million individuals. But what has happened as of 2021 is incredible. If you look at 2021, we have 12 million individuals, and now we have 16 million. That's 4 million more individuals, and 4 million is basically, we have a 33% growth over the last 2 years. And that's why we have been mentioning the fact that 2023 has literally been the best year ever for an insurance agent. And we project this to continue growing, or to at least stabilizing somewhere around here, which is an incredible opportunity for all of us to make a lot of money and to help a lot of people. So the numbers look really good. Now let me go and do the same exercise for the state of Texas. So again, this is Texas now. And with Texas, we started with around 700,000 individuals enrolled in an ACA marketplace plan in 2014. It grew all the way to 1.3 million. And then again, as it happened in the rest of the country, it plateaued there in around 1.2 million individuals. But look what has happened in Texas since 2021. We had 1.2 million. And in 2023, we ended up with 2.4 million individuals. So this is 100% growth. So the situation in Texas has been incredible for insurance agents. We have basically doubled the number of individuals enrolling through an ACA marketplace plan. That means that if you had 100 clients in 2021, you should have 200 clients by 2023. So you should have doubled your income in the last 2 years. And that has happened to many insurance agents that again have received a substantial amount of money in 2023, also align with the bonuses that are associated with certain levels of production. And we will cover how to hit those bonuses when we get into the marketing strategy in session number 3. I want to combine these two graphs here in this one where we see what has happened in the state of Texas, that we already mentioned that it has been a substantial growth, but literally across the nation, the growth has been faster. And what I want to emphasize here is that one of the important characteristics of your ACA business is with the implementation of this, with these online enrollments, you can literally enroll people in another neighborhood, in another city, and in another state, and literally you can enroll people all over the nation. So I want you to keep that in mind, because once you get into enrolling people through an online platform, it's literally the same thing in terms of the process to enroll somebody that is literally next door to your office or your house versus somebody that is in Dallas or is in El Paso, Texas. You use the same license, you use the same process. And if they're in another state, the process is actually the same. But you have to make sure that you are properly licensed and certified in those states in order to be able to sell in other states. But the important thing is that I want you to think outside of your area of influence, of your neighborhood or the place where you have been running your business, because this is something that you can do in many places, and the numbers are there to second that strategy. So again, think USA when you're thinking about selling ACA products. Obviously, in order for you to sell products, you need to be licensed. So I'm assuming, and that's the case for all of you, you are all licensed insurance agents. So make sure that you keep your license in place. We have a couple of courses on the right setup in terms of you licensing in multiple states and all that. We do that in another training. But the point here is that you need to make sure that you are properly licensed. Additionally, you need to be certified. I would hope and assume that by now you are properly certified for 2024. And if that is the case, you should have and you should see a certificate that looks exactly like this one. This is my certificate for 2024. I completed it on August of this year. And this is a final proof that you have completed the certification process. Now, the certification is getting a little bit more elaborate than before. And I want to make sure that you understand all the different elements associated with you being properly certified. So let me get into that, because they have been adding other elements to this, and you need to make sure that everything is in order for you to write business properly, compliantly, and also for you to get paid. By the way, I want you to get familiarized when I invoke any one of these sequences. This is the domain here, and every slash means you go to this other tab. So this will be, you go to our Prinsuco website, and then you go to the marketing and sales tab, and then you go to the ACA marketing tab, and then you go to the ACA sales tool tab. So this is the sequence, and we will provide you with that sequence. But I want you to, this is a live link. So let me just click on it, and that should take us to the actual site there. 1 second, please. It's loading. Let me do it again. I'm going to hit it again. Okay, there it is. There it is. And this is the ACL sales tools and links. That's the sequence that I just showed you before. And this here is in our Prinsuco website, where we have a long list of links that are all necessary for you to run your business. And we will be covering many of these links through our 4th session series. But today, let me get started by showing you this agent and broker marketplace registration tracker link, this one here. Agent and Broker Marketplace Registration Tracker here. And this is how your registration should look once everything is in order. So you're going to enter your NPN number and the zip code associated with your license. So I'm going to do that with mine. And it should show you something like this. This is your Agent and Broker Marketplace registration status for this specific NPN number. And if you scroll down here, it shows you that you have 4 different elements: the portal, the FFN registration, the shop registration, and the valid NPN number. So it shows you everything should be green here. Everything should be green here. And then it shows you specifics about the portal and specific aspects of all your registration process. You see some reds here. Basically, this is the individual marketplace new agent certification. I didn't complete that because I'm not a new agent. I'm a returning agent. So therefore, I completed this one down here. So that's why you see these red buttons here and these green buttons down here. I'm already shop registered for next year, and I haven't completed my help on demand certification. I will be doing that in the next couple of days. Additionally, there is this validation, this NPN validation, which is very important because it incorporates a new concept that all the different departments of insurance have been using since last year that has to do with this concept called LOA, line of business or license only agent active. And this is important because you have to be active with one specific carrier in one state in order for this LOA to be green. So again, this is a new element that has given a couple of issues to some agents that they get certified, but then they don't get contracted, and this shows as red, and so it doesn't give them a full certification status. So again, this is how it should look if everything is in order. This is how it should look if everything is in order. And let me go back to the ACA sales tools and links page. And there are 2 presentations here that I want to emphasize. Number one, this one here, 2024 Health Insurance Marketplace Registration and Training for New Agents and Brokers. And if you click on this link, this is a very long, it has 78 slides, PowerPoint presentation that covers step by step everything that has to do with you going through the marketplace registration. And then on the second one here, 2024 Health Insurance Marketplace Registration and Training for Returning Agents and Brokers. If you click on it, it's going to open another PDF presentation. I'm going to click on this one. And this one is going to show you, this one has, I think, 58 slides, and it shows you all the different things that you need to do in order to complete your returning certification. And basically, what I like to show here is this slide number 8 here, this one here, because it shows you the 4 steps. You have to update the agent and broker profile. Then you have to complete the marketplace training on the MLMSS system. Then you have to read and accept the applicable marketplace agreements. And then you have to confirm completion of all registration steps. So this is basically the process for a returning agent. And again, this is a thorough step-by-step PowerPoint presentation that will give you all the details and everything you need to know in order on how to certify either as a returning agent. In this case, you will use this tab here, or as a new agent. If you are a new agent, then you will click on this one here. This is longer, obviously, but I will strongly recommend you that you do that today. You should not wait anymore. You should be certified by now, because in the month of October, we want to make sure that we get really, really focused on writing that business starting November the 1st. So let me go back to the presentation. Again, this is the full link for that, and we'll place that on the questions tab and in the chat for you to know exactly where you need to go in order for you to look at the instructions on how to get certified as a new or as a returning agent for 2024. With that covered, now we're going to get into the introduction to ACA. And this is something that, although we have been doing this for more than 10 years now, because we started literally on day 0 with the Affordable Care Act, we still get agents that do not fully comprehend this social healthcare marketplace that has been put in place by the Affordable Care Act. The most important concept that we need to understand is that basically the Affordable Care Act created these two worlds. We call them worlds. And on the one side, you have the world of no subsidies, and on the other side, you have the world of subsidies. And it's very important for you to understand that. A lot of agents still don't comprehend the fact that you have the world of subsidies and the world of no subsidies. Under the world of subsidies, if you qualify or if you apply for a product under the world of subsidies, you can decide to take the subsidy provided by the federal government or not, but you're still under the world of subsidies. So that's also very important. You can go to the marketplace and go through the whole process and they say, I don't want any subsidies from the federal government. In that case, you will be under the world of subsidies, but you will take no subsidies. Or if, and this is where the largest number of people dwell in this world of subsidies and taking the subsidy. This is the traditional application where the individual qualifies for some type of subsidy through the federal government and takes the subsidy. So again, this is the realm of the world where most of us do business. But again, you can be in the world of subsidies and not provide a subsidy to a client. On the other side, you can also be in the world of no subsidies, where you can also get an ACA plan. But in this case, that has nothing to do with subsidies. And obviously, when you are dwelling in this world, the number of questions that are being asked is way, way, way reduced, because they're not going to ask you anything about your levels of income or any of that, because again, they're not going to provide you with any type of subsidy. So this is an easier type of process because of the reduced number of questions that are associated with approving something in this world of no subsidy. So again, keep in mind this graph. You have the world of subsidies and the world of no subsidies. And then inside the world of subsidies, you have either take subsidies or not take subsidies. And you as an agent help individuals decide what is the most convenient thing for them. Again, the majority of the individuals we deal with, we work with them under the world of subsidies, taking the subsidies. Any insurance product that qualifies under the world of subsidies needs to follow certain guidelines, multiple different guidelines that are provided and enforced by the federal government. And one of the most important guidelines and one of the most important components of any one of these ACA products is the fact that they need to cover all these, what they have denominated essential health benefits, EHBs, essential health benefits. And there is a list of 10 different areas of healthcare management that are an obligation in any one of these products. You have maternity care, habilitative services, pediatric services, mental and behavioral treatments, preventive and wellness services, hospitalization, lab work, medications, ambulatory services, and emergency services. So you have 10 different essential health benefits that are always present in any one of these products. It's very important that when you are presenting to any one of your clients, any one of these products, you mention these 10 different essential health benefits. And there are multiple reasons for that. The one that I found the most important is the fact that you are providing this family or this individual with an incredibly comprehensive product that is full of benefits. And in many instances, these individuals are not paying that much for that product, because let's say the product costs $2,000 a month, but they get an $1,800 subsidy, so they're paying $200 a month. And if you didn't do a good job in explaining to them everything about the subsidies and all that, they think that they're getting a $200 a month product to cover them or their entire family. So they really believe that it's some type of cheap product that must not cover many things. And that is the wrong assessment, because these products are full of benefits and they're very expensive. But the fact that they're only paying $200 has to do with the subsidy provided by the federal government. So it is your job to make sure that you explain to them all aspects of the coverage that they will have and the abundance of concepts and situations in which they're going to be covered. So again, my recommendation to you is always make sure that you read to them each one of these essential health benefit categories and spend some time during the presentation making sure that they understand of the abundance of coverage that they're getting through this product. So this is point number one, essential health benefits, EHBs. Make sure you read them to them every time you make a presentation. Another element that was introduced by the Affordable Care Act has to do with this naming that they created, where they gave these different products the names of different metals. So they came out with the bronze product and the silver product and the gold product and the platinum product. And that's why we refer to them as the metallic products, because they have the categories are basically aligned with different metals. But everything has to do with the amount of money that the insurance company pays and the amount of money or the percentage of money that the individual has to pay. In the case of a bronze plan, an insurance plan pays 60% and the individual pays 40% of the maximum exposure that that individual might have. And this is all associated with a concept that gets a little bit complicated that is called actuarial value. And I don't want to get into that. But basically, this is 60%. The insurance pays 60%, and the individual pays 40% of the maximum exposure that the individual might have. And I'm going to cover that later in this training today. So that's the case for a bronze plan, 60-40. And then you go to a silver plan, is 70, insurance company pays 70%, the individual pays 30%. Then you have the gold plan, where the insurance company pays 80% and the individual pays 20%. And finally, you have the platinum plan, where the insurance company pays 90% and the individual pays 10%. So these are the metallic products: bronze, silver, gold, and platinum. And again, it has everything to do with what percentage the insurance company pays and what percentage the individual pays. 60-40, 70-30, 80-20, 90-10%. Okay. Now let me take these two concepts and put them together. I was talking about the world of subsidies and the world of no subsidies, and then I was talking about the tiers. So you do have products in the world of no subsidies and in the world of subsidies, and they all have, they are either bronze or silver or gold or platinum. So you can have them here or you can have them here. Now, if you have them under the world of subsidies and the individual does not take subsidies, you still have these products here. And if you do it under the world of subsidy and the individual does take the subsidies, again, this is where we dwell the most, is in this group here. But the structure is the same, no matter that you are under the world of no subsidies or the world of subsidies, with subsidies or without subsidies. So let me just cover some of the fundamental consequences of selecting another one of these products. In terms of the monthly premium, When somebody selects a bronze plan, they're going to pay the lowest monthly premium. It will be the most economical product that they can get. If they select a silver plan, in terms of the monthly premium, then the monthly premium will be moderate. And this goes all the way to platinum, where in terms of the monthly premium, if somebody selects a platinum plan, the monthly premium will be the highest. So if somebody wants the lowest premium, they will select a bronze plan. And if they want the highest premium, they will select a platinum plan. Now, let's talk about the cost when somebody needs care. In terms of cost associated when the moment that you need care, if you select a bronze plan, that cost will be the highest. And in terms of a platinum, that cost will be the lowest. So again, you see this trade-off between selecting a bronze plan or a silver or a gold or a platinum plan, where number one, you pay the lowest on a monthly basis, but then you pay the highest whenever you use the program. In this case, you pay the highest on a monthly basis, but then you pay the lowest when you use the plan. In terms of deductibles, the bronze plans have the higher deductibles, and then the platinum plans have very low deductibles. So again, everything associated with these bronze plans have to do with how much you're going to pay upfront, how much you're going to pay when you use it, and then each individual and you, each insurance agent, need to help each individual to make a decision with regards to which one of these plans is the most convenient one for that specific family, based on a needs assessment that you have to go through with each one of these families to make the best possible decision for them. So this graph here is important in terms of the fact that we do have all these metallic products all over the place. Some agents don't understand this. Some agents think that there are no metallic products under the world of no subsidies, and that is not the case. This is what they refer to sometimes as you go directly to the carrier to buy directly from them off the marketplace, offline. So this will be this group of products here. Again, here you will not have any type of subsidy from the federal government. And additional, you would have to answer way less number of questions because, again, nobody's going to give you money or give that family money to subsidize the monthly premiums. So that's the arrangement with regards to the metallics. When you put them over, you do an overlap with the different types of situations that can present. Aside from the metallic products, in the world of no subsidies, you have a whole array of additional products that do manage healthcare. So these metallic products are not the only way an individual can have health insurance coverage. You have many short-term medical products that also handle healthcare management situations, and you have supplemental coverage. Individuals can have accident policies, critical illness policies, cancer and heart and stroke policies, indemnity policies. There is a whole array of products here under the world of no subsidies that in certain instances is the best combination for some individual. So keep this in mind because there are going to be instances where you might be considering something that is outside of the world of subsidies, something that is not a metallic, and you can come up with a combination of different products that can very effectively take care of that individual or that family's health coverage situation. So again, keep in mind, in this world of no subsidies, a whole array of ancillary products, as they call them, that can also help with health coverage. Also, some agents combine some products on this side of the world of no subsidies with some metallics products, and they complement the product. That's another way to do it, and that's something that we might cover in another training, but not today. Now let's change gears and start talking about the networks. And the network, it's basically the most important element associated with these ACA plans. And I say that from the perspective of you getting into trouble with your clients, or your client being disappointed with you and feeling really bad about the product you recommended to them because network issues. So it is very important. I would say that 60-70% of all the problems associated with ACA plans are directly related to the networks. So it is very important that you, number one, understand how these networks work, and number two, that you properly explain to the client how these networks work. We basically have three types of networks. We have HMOs, PPOs, and EPOs. And HMO stands for Health Maintenance Organizations, PPO stands for Preferred Provider Organizations, and EPO stands for Exclusive Provider Organizations. And basically under an HMO, and the majority of the plans under the Affordable Care Act with subsidies have an HMO structure, so they are mostly here. It's basically a structure where you have a primary care physician that will refer the client to the basic services and would also refer the clients to all the specialists and everything within their inner circle or their inner network. So they will never, under an HMO, they will never refer somebody outside of a very specified, aligned network, very clearly defined network that the individual must use if they are enrolled into that plan. So an HMO is a network structure that is very limited and reduced and properly defined, and the rules are very fixed in terms of how to use the system. On the other side, this is the most economical way to manage these products. So these are, if you see the amount of money individuals pay under an HMO, if they use the network, they pay very little or the lowest amount possible. But if they go outside of the network, if they dare to move outside of the network, basically they have no coverage. And you can run into a situation here where you have somebody paying a lot of money and coming back to you very pissed off, telling you that you need to pay the $80 or $100 or $150,000 that they're billed because they went outside of the network. So under an HMO, individuals cannot go outside of the network. Now let's see how the PPO works. And the PPO, again, I mentioned before that it stands for Preferred Provider Organization. And basically, in a preferred provider organization under a PPO, you have the individual. There is no a requirement of a primary care physician. So you don't have a primary care physician under a PPO. And basically, that individual can go inside of the network. So there is an inner network that has a cost structure, but they can go also outside of the network. They can also go outside of the network. Now, they will pay a higher amount of coinsurance or copayments or whatever, but they can go there and they are covered. So that's a PPO. It's a more expensive type of plan, so they will have a higher monthly premium. And again, they can select to go to the inner network, the preferred provider network, and have a specific cost structure, or they can go to the outer network. They can go to the outer network and they will have to pay more, but they have that option. So it's an option for them to go to decide if they want to go to the inner network and pay less, or they can go to the outer network and pay more. And again, the individual has to decide on that. But you need to make sure that when you are presenting one of these plans to one of your clients under a PPO format, that you explain to them the cost structure associated with the inner network and the cost associated with the outer network. And then we have the EPOs, exclusive provider organizations. These were basically created with the Affordable Care Act. And initially, there was no many of these out there, but they're becoming more and more popular. And this is basically a combination of the two, where an individual can go directly to the network, or he or she can use a primary care physician. So it's a mixture of the both systems. I strongly recommend it for individuals to do have a PCP. This is a doctor that can help them make make healthcare decisions. So it's convenient to have a primary care physician, but is there alternative to do it or not? Obviously, if they go through the PCP, they're going to pay less than if they go directly. But under an EPO, they have more flexibility and they can move better within the network. So these are the three types of networks. Let me tell you that as these carriers have been developing, initially, basically most of them only had, for all the product portfolio, one network. But now, as things are maturing and things are getting more organized, many of these carriers, especially the big ones, have within their portfolio of products 2 or 3 different networks. And this creates confusion, because in the past, when you would select a carrier for a specific client, basically there was only one network. Now, with that same carrier, you might have 2 or 3 networks. So you, the insurance agent, needs to know what network you are putting them in. Because an individual can go to a doctor with that carrier, and guess what? That doctor or that hospital does not take that plan, because it's all about of what network they are in. So you need to be aware of the fact that many of these carriers now include 2 or 3 different networks for the different product portfolios, and that's something we covered thoroughly in the product training, product specific training. But we have seen a lot of agents that say, well, I put this client in this with this carrier, and he's paying very little, but now he wants to go to a doctor or to this facility, and the facility is saying that they don't take that plan. Well, guess what? That was your mistake as an insurance agent, because you didn't do your due diligence and you didn't check what type of provider goes with what network. So again, beware of the fact that carriers now are including 2 or 3 different networks within the portfolio, and you need to make sure that you know exactly which network you are putting your client into, so that you don't say the wrong thing, and then come April or May, or when they are using the plan, then they're going to feel very disappointed, and they're going to be calling you and complaining to everybody. So the network becomes a very important element. The EPO is something that has come to present a solution, because you have the rigid structure of an HMO and the very flexible structure of a PPO, but there was a substantial price difference between these two formats of networks. And the PPO, it's an overlap of many of the characteristics of HMOs and PPOs, so it has created a very specific niche where it combines, basically, we could say that the best of 2 worlds. So the point is that when you are doing your selection and you start looking at the networks, if you can see something that has the EPO structure, that's something that is going to help you stay away from problems, because these are very flexible structures that are out there now. So again, you need to make sure that when you're selecting a plan for any one of your clients, when you're looking at the networks, you need to have absolute clarity of what type of format, what type of structure the product has, if it's an HMO, if it's an PPO, or if it's an EPO, and the specific name of the network, so that you don't create any confusion for yourself and or for your clients. We're going to shift gears now and go into the cost structure of a health insurance plan. And again, this is something that we have been working on with agents for the last 10 years and also with the clients, because you need to make sure that you educate your client in this cost structure. In many instances, individuals only consider the first element in the cost structure of a health insurance plan, and that is the monthly premium. So they just focus their decision on what product they're going to be buying based on the monthly premium. And that is a major mistake, because that means that they are not paying attention, or they are completely unaware of the fact that you have 4 additional elements that are also very important, and that they will come back to bite them in the future if things go the wrong way. So we have 5 cost elements. We have the monthly premium. Then we have deductibles, which in some instances are very important. Then we have coinsurance, which is a percentage of the cost. We also have copayments, which are a specific amount of money, $40, $10, $50. And then you have this maximum out of pocket. Maximum out of pocket, which is basically the summation of elements 2, 3, and 4. So the summation of deductibles and coinsurance and copayments. And this maximum out of pocket is a number that you need to become aware of. You need to be acquainted with the maximum out of pocket that a product has. And I'm going to show you some guidance with regards to that. But again, the cost structure of a health insurance plan, 5 elements: premiums, deductibles, coinsurance, copayments, and the maximum out of pocket, which is the summation of elements 2, 3, and 4. Make sure that you are aware of that, and that you let your client become aware of that cost structure. Once they are acquainted with that, then you need to become familiarized with the cash flow associated with that cost structure. You have different types of products where basically you have a very high deductible, and everything happens after the deductible has been met. In many instances, those products have a small monthly premium. So the individual pays a small monthly premium, but then they have to, out of their pocket, pay for a lot of money until they satisfy that deductible. Once they satisfy that deductible, then all the benefits kick in. This creates a lot of problems, because in some instances, this amount of money here to get all the way to satisfying the deductible can be $4,000, $5,000, $6,000, $7,000, $8,000. And that might be money that not too many people have to spend. So when you consider a plan that has a very low premium, always take into consideration how they're approaching the concept of the deductible, because if you are placing an individual in a product that has this cash flow structure here, those individuals are going to be hit with a lot of expenses before the actual health insurance coverage kicks in. And guess what? They're going to come back to you and complain about it. If you want to avoid that situation, that scenario, then you need to make sure that you get them into a product that has a higher monthly premium, but where some of the copayments and the coinsurance elements are outside of the deductible. They don't have to meet the deductible in order to pay those copayments or share with that coinsurance. This is very important because, for example, if there is a copayment of $40 to see the doctor, and that copayment is after you satisfy the deductible of, let's say, $8,000. If that individual wants to go and see a doctor, first they have to pay the totality of the consultation until they spend those $8,000. Well, guess what? What's going to end up happening is that that individual is most probably going to avoid going to see the doctor because he or she has to pay a lot of money to see the doctor. But if they have a $10 copayment or a $40 copayment, then they are very much incentivized to go and see the doctor. Again, this is under one of those products with the copayments and the coinsurance are outside or not related to the deductible. So you want to make sure that you always consider one of these structures in terms of cash flow. Again, one of the characteristics of those products is you start with a probably higher monthly premium. But again, that's a trade-off that the client needs to decide on, but that you, as the right insurance agent, should let them know about and guide them and recommend based on their financial situation. So the cash flow structure in an ACA plan becomes a fundamental element of the decision, and you need to make sure that you properly understand all these elements to be the right insurance agent. In terms of how we can help these individuals, we can help individuals in two different ways. And remember, when you go through that certification that we covered at the beginning, basically you are getting certified with the federal government so that on behalf of the federal government, you extend these subsidies to these individuals and all this help that they can get. So that's part of the certification process. And once you are properly certified, you can help individuals in two different ways. The first one is what we call the Advanced Premium Tax Credit, the APTC. And basically, this has everything to do with that monthly premium. So the amount of money that they have to pay on a monthly basis. So let's say that the monthly premium for a specific plan for a family of 4 or a family of 5 is $2,000 a month. If you can help them with a subsidy, with an advanced premium tax credit, that's the technical name for the subsidy, the APTC, of $1,800, then that family will not be paying $2,000 a month, but only will be paying $200 a month, because the other $1,800 are the advanced premium tax credit. So they get a subsidy of $1,800, they only pay $200 a month. That's the first way you can help a client, through the advanced premium tax credit. But remember, as we mentioned before, in the cost structure of a health insurance plan, you have 5 elements. Not only do you have the monthly premium, you have deductibles, you have coinsurance, you have copayments, and you have the maximum out of pocket. Well, you can also help individuals in lowering those deductibles, lowering that coinsurance, lowering those copayments, and lowering the maximum out of pocket. And you do that through the cost, let me change this, through the cost sharing reductions, through CSRs. So you can help individuals in 2 different ways. One, through the advanced premium tax credit, the APTC, and 2, through cost sharing reductions through CSRs. With the advanced premium tax credit, you help them pay for the monthly premium. With cost sharing reductions, you help them with the deductibles, with the coinsurance, with the copayments, and with the maximum out of pocket. And you can help individuals with all of that, or some of that, or they can literally do not take any type of help. And again, that has everything to do with the initial slide that we presented in terms of where you are in the world of subsidies, and if you take the subsidies or you don't take the subsidies. So everything that we're covering is related in one way to another to all the concepts that we are covering today in our presentation. There are certain numbers that you need to become familiar with every year. And those numbers change on a yearly basis. So this is 2 numbers that I really need you to become familiar with for 2024. The first one is, for a single individual, the amount is the annual cost sharing limit. The annual cost sharing limit for 2024 for a single individual is $9,450. $9,450. That is the number. And you need to become acquainted with that number. And for a family, the number is $18,900, which is 9,450 by 2. So the annual cost sharing limit for an individual is $9,450, and for a family is $18,900. $6,900. That is the maximum amount. Remember when we were covering the cost structure and we were talking about the maximum out of pocket? Well, these are the maximums out of pocket for an individual and for a family, no matter how many members in the family. So that means that after the two first members of the family have completed the annual cost sharing limit, then the third one and the fourth one do not have, they don't cost any additional money. Now, all of this is aligned with being in the right network and making sure that you use the network properly, etc. So again, this is also, these numbers become real if an individual uses the product properly. That has a lot to do with the network structures that we just covered before. So you need to understand that all of this is connected to the network structures, and that these numbers hold if and only if the individual is using the network the right way, using the plan the right way. So again, become acquainted, familiarize with these two numbers for 2024. And again, these numbers change on a yearly basis. Here we have the 2024 federal poverty level chart with cost sharing reductions. And we have brochures, we have banners, we have tablecloths with this chart, with this matrix that you see here, because this chart here, it's all about the levels of subsidy that a family can receive based on their financial situation. So let me get into the specifics of the 2024 federal poverty level chart with cost sharing reductions. On the first column here, we see the household size, And this is the number of people basically in the family income tax declaration. So you can have a household size of 1 or 2 or 3 or 4 or 5 or whatever. So that's the number of people in the tax return. So if you have a family of 1, and then 100% of what we call FPL, the federal poverty level chart, it's this number for 2024, 14,580. That's the starting number for everybody for 2024. For a family of 1, 100% of FPL is 14,580. Now you see these red lines here, and I'm going to over those lines and what they mean. But basically, depending on where you land or where the family lands in this table, then that's going to determine the level of help that you as an insurance agent can help them apply for. So if an individual or a family has a household income all the way to 150% of FPL, so that means if they are in this green box here, anywhere here, they will get up to 94% of the actuarial value in a silver plan. So that means that they will get help to pay for the monthly premium, and they will also get help with cost sharing reductions. So if they fall anywhere within this first box here that goes all the way to 150% of FPL, they get the maximum amount of subsidy for the monthly premium and the maximum amount of subsidy for the cost sharing reduction. Now, if they go all the way to 200% of FPL, which means for a family of 1, this will be 14,500 times 2, which will be 29,000. Then they will get up to 87%. Let me change this here to 87% of the actuarial value in a silver plan. So they will still get help to pay for their monthly premium, and they will still get help for the cost sharing reductions. If they go all the way to 250%, and this is a very light green color here, again, they will also get help, but they will only get up to 73% of the actuarial value. And 73% of what? Remember the numbers that I told you that you needed to know about, the individual and the family limits. Well, this is 73% of that number. This is 80% of that number, and this is 94% of that number. And let me go back to what number I'm talking about out of these numbers that we see here. So it will be a percentage of this number or a percentage of this number based on where they fall in this table here. If an individual or a family makes over 300% of FPL and all the way to 400% of FPL here, they will get help to pay for the monthly premium, but they will not get help in payments for the cost sharing reduction. So if they make over 300% of FPL, that means 300 or more, then they can get help with their monthly premium. So anywhere, if their income falls anywhere here in these two columns here, they can get help with the monthly premium, but they will not get help with cost sharing reductions. If an individual makes more than 400% of FPL, then they will not make any type of subsidy to pay for their health insurance. So this table, again, it's for conversation. I strongly recommend, if you have an office, and we can provide you with this table. Again, we have brochures that include this table and includes other information there. Ask in the chat for, and we will send you a package of these brochures. And this is something that you can include with every presentation that you make to any one of your clients. Additionally, you can get a large one that you can place in a wall in your office or as a tablecloth, because this will generate a lot of questions. And these colors are going to help you identify where individuals or families, where do they fall, and how much help you can provide for them. And instead of you getting into all the specifics, you can just very rapidly say, hey, if we add up everybody in your household, let's say it's a family of 4, if we add up everybody in your household and we add up all the income of everybody in your household, where do you fall in terms of this table? So they say, well, we fall around this 60,000. Well, you know that they are at 200%. Right now, you already know that they will qualify for subsidy for both their monthly premium and for cost sharing reductions, because they are in this category here. Again, it goes all the way to this category where they get subsidies for the monthly premium and help with the cost sharing reductions up to 73% of the actuarial value of the numbers that we saw on the slide before us. Now you have a lot of numbers here, but literally you only need to know 2 numbers with all this table. The first one that you need to know is this 14,580. Okay, so family of 1 is 14,580, and then you need to know a second number, which is, if you do the math, each one of these elements in this column, they're adding to each one of them $5,140. So basically, a family of 2 is the first one plus 5,140. Family of 3 is the first one plus 2 times 5,140. The fourth one would be this plus 5,140. Let's look at a family of 4, and this is where you can see the 5,140. Family of 4, $30,000. Family of 5, 35,140. You see the 5,140 right there. So again, you only need to know this number up here and the 5,140, and you can make up the totality of this table. You don't need to memorize that. I just wanted to let you know that basically you start at 14,500, and each additional family member, you add 5,140 at the 100% FPL, and then you just need to multiply for whatever factor you need to do in order to get the actual amount. But as we will see in our Health Sherpa session and with the EDE platform, where all of this is calculated for you, and you can just present the concepts and not the specifics, because the numbers will be provided to you. But again, this table will help you start a lot of conversations and will help you guide individuals in terms of the importance of making sure that they provide the right information so that you can help them. So this is the 2024 federal poverty level chart with cost sharing reductions. Very important element. Make sure you have it handy. Make sure we have a lot of brochures to provide you with. And if you want, we can provide you with tablecloths or posters with this information, because again, this is going to generate activity, which is going to help you write more business. So we have this situation with regards to what do we recommend or what do people normally want? And we have categorized it as this fight between a silver and a bronze plan. And you need to understand the difference between those two. Remember that anybody that falls between 100 and 250% of FPL, and we already covered that in the table that when we were looking into the specifics, may be eligible for CSRs to help them with their out-of-pocket costs. So anybody that it's between 100 and 250% of FPL can also get help with cost-sharing reductions, but only if they're enrolled in a silver plan. That will not be the case if they're enrolled in a bronze plan or in a gold plan or in a platinum plan. It only works if they are enrolled in a silver plan. So many individuals that are CSR eligible, that means those individuals between 100% and 250% of FPL, have to make a decision, have to make this choice between going with a bronze plan with a lower monthly premium or going with a silver plan that will provide them CSR help for out-of-pocket costs. And that is a major decision that individuals need to go through. If they go with the lowest premium plan, the bronze plan, then they might be in a situation later where once they require medical services, they might find themselves in a situation where they have to pay higher out-of-pocket expenses. And they most probably are going to come back to you and complain about it and all that. So again, it's very important that you have clarity on this. What I have found over time, and we manage literally thousands of agents and many very successful ACA agents, this is where the agents make a stand, and this is one of the situations where the agent becomes an advisor to the individual and recommends the right product. Remember, you need to be the right insurance agent, and this is one of those situations where you are either the right insurance agent or not. If you're just an order taker or you are an advisor. And it comes down with these plans. A lot has to do with this decision about silver versus bronze plans. So again, make sure you are aware of that. We have the Medicaid gap, and that's something that is present in most states. But basically, the Affordable Care Act started helping people at 100% of FPL. The marketplace subsidies, and let me change this, the marketplace subsidies in general start at 100% of FPL. Supposedly, the states were going to increase their Medicaid coverage all the way to 100% of FPL, but many states didn't do it. Many states didn't do it. So you might find a situation where somebody is at 110% of FPL and gets basically a product for $0 a month, and somebody that makes less than that, and they have to pay the totality of the amount. And this has to do with this Medicaid gap. So I want you to be aware of the fact that this situation can occur, and basically you need to make sure that you understand what's going on there. So beware of the Medicaid gap. It starts at 100% of FPL, and it's a reality in many states in the union. We also have this employer-employee family glitch. You see, we have a situation where anybody that is being offered insurance through their employer should not be able to get a subsidy through the marketplace. But in some instances, some of these employers offer this package to the family, which are not affordable. And in that case, the individual has a situation because he's confronted with this very expensive plan through the employer or no insurance at all. Well, what some agents have done is that they have presented the information to the marketplace, avoiding certain information or not including certain information, and registering somebody in the marketplace even though they have insurance through their employer. And this, although provides that individual or family initially with a subsidy, then when they do all the audits years later, then they found out that that individual or that family was not entitled to that subsidy, and then they come back and charge them for that. So what I want you to be aware of here is the fact that you always need to bring into the conversation what type of relationship they have with their employer and what type of coverage they get from their employer. And that becomes paramount in your decision to help them or not help them. I don't want to get into the specifics. The concept of affordability at this time is it cannot exceed 8.39%, which is down from 9.12% from last year. But what I want to emphasize here is that you need to make sure that you bring the employer into the conversation and what type of coverage they are offered or not offered through their employer. Because if you missed the information on this one, you can end up getting somebody penalized or fined in the future, and you don't want to be involved in a situation like that. So beware of the employer/employee family glitch. That's something that you need to bring into consideration. Additionally, there is this HRAs, health reimbursement arrangements. And you need to become familiar also with the health reimbursement arrangements. Health reimbursement arrangements, HRAs. And this is a type of account-based health plan that certain employers provide their employees with, where the employer provides some money to the employee, and that employee can use that money to pay themselves for certain medical care expenses. So HRAs are a reality. They're not that common, they're not that popular, but it's something that, again, as we mentioned before with the employer/employee family glitch, you need to know if an individual is being offered an HRA through their employer, because if that is the case, then you need to take into consideration other elements to decide if it's convenient or not to enroll them in an ACA plan. And let me get a little bit more specific about this. There are certain rules. So there are things that you as an agent need to know, and there are certain things that the client needs to know about HRAs. So the way it works is the employer contributes a certain amount to the HRA account. So the employer says, okay, I'm going to give you $3,000 a year or $5,000 a year, or whatever, X amount of money to the HRA account. Then the employee uses that money to pay for qualified medical expenses. And that qualified medical expenses, depending on the type of HRA, can even be used to pay for the monthly premium. So again, they can use the money that is provided by the employer into the HRA account to pay for medical expenses, including the monthly premiums. Now, the employee must have health coverage to use the HRA. It's not just for any expense. It has to be that the individual has to have an ACA plan in order to be able to use the HRA. And the individual needs to know that if they use the HRA wrong, they might be penalized. And I'm going to get into the specifics of that with this next slide. There is a number here I couldn't confirm for 2024 the required contribution percentage. So this was the number. I know this is the number for 2023, and I looked for it. I have been looking for it, and I haven't been able to find it anywhere. So we're going to stick with this 9.5% for the time being, but it's probably going to change in the next couple of weeks or months. But for the time being, we're going to use 9.5%. So this is the individual coverage HRA affordability percentage. And this number becomes very important in the way all of these HRA plans work. And let me tell you how it works. Let's assume here that the company offers the individual a $3,000 per year HRA account. So the company is going to provide the individual with up to $3,000 per year for the HRA account. And let's assume also that that household income is $30,000 a year. So the family makes $30,000 a year, and they get a $3,000 HRA account. The way this works is you take the HRA contribution divided by the household income. So in this case, it will be 3,000 divided by 30,000. That's 10%. 3,000 divided by 30,000 is 10%. Well, 10% is greater than 9.5%. So basically, we can conclude that this HRA plan is affordable. So the company is giving them something affordable. If the company is providing the individual or the family an affordable HRA plan, then that individual cannot get an advanced premium tax credit in the marketplace. So he's not eligible for the subsidies because he's getting an affordable plan help from the employer. So in this case, the individual should accept the HRA offering from his employer. If this was not the case, if this was not affordable, then he should not accept the HRA from his employer, and he would then be able to enroll in an ACA plan and get all the subsidies from there. So if an individual accepts an HRA offering, then they need to apply and enroll and accept the plan. So that's that's an HRA accept HRA scenario. We have in other trainings, we go over all the different possibilities and the calculator and all that, but we're not going to be covering that today. There is another document that I strongly recommend everybody to download or to order from the marketplace. And this is this Get Ready to Apply or for Re-enrollment in Your Health Insurance Marketplace Coverage. And this is a document that I strongly recommend that you order, download, and print at least one time and do it in color and read it, because this document is going to provide you with all the guidelines and all the questions that you really need to ask your client. So this is a really good document that is going to help you and guide you through the conversation that you need to have with your client in order to get all the information that you need in order to enroll them. So download it, print it, and at least read it once. But it has, let me emphasize here, it has information on the household. So a lot of information on the household. And then information on how to contact everybody. So very important, all the addresses. And then information about everybody applying for coverage, because you can have a household of 5, but only 3 individuals applying for coverage. You can have that. A lot of agents get confused with that. They don't know how to manage that situation. You can have a family of 5, but only one coverage for one individual. Yeah, that is valid. But you still need the information. If you want to apply for subsidies, you still need everybody's information in order to apply for that subsidy for that one individual. So you also need information about Social Security numbers, about information about, this is very important because this is who is helping you. Do they already have an agent, or have they been doing it by themselves? That is very important. That is very important because you want to make sure that you become the agent of record and that they pay you for all the services that you are providing. Information on all the immigration documents. So another important element, again, these are the questions that need to be asked. Information on how they filed their taxes. How do they file? Do they file maybe filing jointly? Do they file single? Because again, they might be forced to change the way they file their taxes based on all these subsidies they're going to be getting. So you need information about the way they file their taxes. Information about their employer income and information about everyone in the household. So it's not just the income of the breadwinner, it's information on the income and employer for everybody in the house that works. That's very important. Sometimes they leave one or two of these individuals out, and then all the numbers are thrown off, and then you have situations where you have penalties coming back. Now, again, on this one, this is also information on income, but this one here is the present, and this one here is the future. What do I mean by that? Here is the actual facts of the situation today. How much am I making today? And where am I making that money, with what employer, etc. So this is the present, this one. This is the present. But this one is an estimate, and an estimate of your household income into the future. Why? Because we're looking into the future. So you need to have an estimate of what the income is going to be next year in order to make the calculation. So you have fact here and estimation here. And the numbers that we use in order to calculate is the estimates for next year. Now, again, we have ways to, once that estimate is correct or not correct, we can adjust through the year to make sure that we're getting the right number. But again, this is fact and this is estimate. You need to cover both elements. How much are you making today? That's one question. That's a fact. There is no play in that. How much are you making today? That's a real, very specific number. What is your estimate of what you're going to be making next year? That's different. That's an estimate. It's your best guess of what it's going to be. Okay. And it's a different number, or maybe the same number than what you're getting today. And finally, and I mentioned the information on the, if they do have current health coverage. Again, this brings employers, this brings health reimbursement arrangements. So what type of coverage do you presently have? Do you have health insurance through the marketplace? Do you have health insurance through your employer? Do you have an HRA account with your employer? That is very important, because that's also going to influence, and it's going to change the level of subsidy and the level of help that you can provide to them based on this last question. So again, my recommendation is download this form. Let me go back and show you the form. This is the name. Get ready to apply for or re-enroll in your health insurance marketplace coverage. Download it, print it in color if possible, and read it once and use it as a guide in your conversation. This is going to help you get very much acquainted with the individual or the family, and it's going to make sure that you cover everything you need to know in order to be the right insurance agent. If you don't do this, and you just do like many agents do, that they just go to the actual platform and start answering questions, there is a higher percentage of probability that you miss out on some of these questions and you end up enrolling the individual in the wrong program or under the wrong level of subsidies because of you missing some information. So again, this document helps you a lot. Now, once you are ready to enroll, there are three different ways to enroll. One is the marketplace pathway. The other one is what we call the classic DE, the classic direct enrollment. And finally, we have the enhanced direct enrollment pathway. I don't want to get into too many details of this, because basically this was very clear at the beginning, but now everything is moving towards an EDE, and everybody uses an EDE, a platform, and we have a whole session on that, on session number 2. So I don't want to get too much into this, but basically an individual can go directly to healthcare.gov and enroll somebody and enroll themselves in the marketplace. Now, you as an agent or broker can assist consumers what we call side by side in the marketplace. But that means side by side. That does not mean that you take over their account. That means you are with them, but it is their account, is their username, is their password, is their information, okay? And you need to make sure that it stays that way, that they control their account if you're doing it under the marketplace pathway. What you want to do is you don't want them to use the healthcare.gov platform. You want to help them on your platform. And that's everything we cover when we go through session on the Health Sherpa platform. Then we have the classic direct enrollment, the classic DE. And basically, these were platforms that are also moving into EDEs now, but they're still there. And basically, it's a platform that you as an agent can buy on a monthly basis or rent any one of these platforms. And basically, you go to this portal and you enter some information. Then you go to the marketplace and you do some of the process in the marketplace, and then you come back to the platform to finish it. And that's how these classic DEs work. They are all moving into EDEs. So this is probably going to disappear. These classic DEs are on the way out, so I don't want to get more specific about that. And then you have the enhanced direct enrollment. This is a platform. They are fully functional. Today they cover all aspects of the relationship. You can quote there, you can enroll them there, then you can do follow-up, you can do automated marketing, you can do a lot of things under these EDEs. And this is the way, not of the future anymore, but the way of the present. So we use Health Sherpa for that. And for those of you who have had an EDE platform through a carrier, for example, in many cases, Ambetter will provide you with their Health Sherpa account. So you would have a Health Sherpa account through Ambetter. And then Molina would also provide you with a Health Sherpa account, but that one was for Molina. Well, you don't want that. What you want to do is you want to make sure that you open your own Health Sherpa account that is to your name, and then you connect all the different carriers there. And that's how we recommend that you run your business. And again, we're going to cover a lot of these in a future training. But the important thing is that these EDEs incorporate all aspects of the business and allow you to become way more efficient when you are dealing with all these clients and information about their status and their situation and if they have been paying or not, etc. So again, the way to go is with EDEs, enhanced direct enrollment pathway, and specifically you need to make sure that you have your own Health Sherpa account, and we're going to help you connect all the different carriers to your Health Sherpa account. And that's what we want to do. In terms of the enrollment period, the annual enrollment goes from November the 15th of 2023 all the way to January the 15th of 2024. So this is the open enrollment period, November the 15th to January of 2024. During the fall, the marketplace has been sending letters to the enrollees to inform them of all the changes. So they might have been receiving these letters. Starting on November the 1st, all the way to January 15th of 2024, individuals make OEP plan selections. So again, anybody can enroll into any one of these plans without having to use any type of SEPs or anything. It's the annual open enrollment, and this is the time where individuals can just do it. Now, if anybody made a plan selection between November the 1st of 2023 till December the 15th of 2023, they will become effective on January the 1st of 2024. So the last day to be effective for January the 1st of 2024 is December the 15th of 2023. And then plan selections completed and received by the marketplace from December the 16th to January the 15th of 2024 become effective February the 1st of 2024. That's when the open enrollment period ends. So this is the enrollment period, and this is the time of the year that we have been working on. It is very important to obtain consumer consent. This slide here covers the elements about consumer consent that were in place before they made the changes back in July of this year, which substantially improved on this consumer consent. So I don't want to get into all the specifics of consumer consent. We're going to have a full session on that, and we have them in our website where you can look at them. But there is one important thing that I want to emphasize, and it has to do with this third point here. And it says, if agents and brokers are aware of others who are conducting a search for consumers' applications using approved classic or enhanced DDEs without their consent, you need to report them. That's what I want to emphasize. That if you find out that any agent is not following these rules with regards to all the consent forms that are in place today, you need to report that. And there is an email address there where you need to report that. And I encourage you to do so, because we need to stop all those bad actors out there which are taking away your clients without authorization and without getting the approval from the client. So again, I'm not going to get into the specifics of the consumer consent in this session. I just want to make you aware that they exist and that you need to report anybody that is not following these, because we're going to get very deep into all the forms in our next training. So there are certain things that you need to make sure, again, as I mentioned before, make sure that you don't use your email as the client's email. Make sure you don't use their account as your account. Make sure you are not using the password to log in as them into the healthcare.gov account. So there are certain elements that you need to make sure that are always there, and that you basically be the right insurance agent. Use common sense plus know the rules in order for you don't get in trouble and do things the right way. Now, how does the marketplace work? And this is something incredible, because this looks so basic, so simple. Well, you create an account, then you apply for the federal subsidy, then you select a plan, and you enroll in a plan. That sounds very easy to do, but I run into situations where a client has basically 10 accounts. What does that mean? That means that the agent didn't know this basic slide. And every year, they create a new account for the client. Well, guess what? You don't need to create 10 accounts. You create one account. So if you find somebody that has 10 accounts, that means that the agent that has been dealing with them, or the agent that have been dealing with that individual, don't know what they're doing. So the first thing you need to do when you're working with somebody is find out if they already have an account. And then you work on that account. And that way you make sure that you change the agent of record and that you do things right. But again, we run into a lot of situations where an individual gets a new account every year, because every agent that comes in starts in the wrong place and creates a new account for the client. So always look for the account that they already have. If they have had any type of subsidy in the past, they have an account. So make sure that you just create an account one time. Or if they already had an account, make sure you use that account that they have and then work on that account. That's one safe way to making sure that you become the agent of record and that you clean everything that you find in the process that was not done the right way. So only one account clients should have, and then make sure you work on that account year after year after year. Make sure you find that account and that you correct any anomalies that you find in that account and clean it, and then control with the client that process through that one account that they have. So again, that's how the marketplace works. Very important, no matter that you do the short application or the long application, and in fact, specifically with Health Sherpa, basically the most important thing that we need to emphasize here is the fact that you need to make sure that you are the agent of record, because that's the only way they're going to pay you for that job that you did. So under the short application or under the long application, there is always a space there that says if somebody helping you, and you need to make sure that you say yes, somebody's helping you, and you provide your FFM user ID and your MPN number always. Now, if you do it through Health Sherpa, it's automatic, so the information is already populated, so you can avoid having to find if you are the agent of record or not. But again, very important that if you are helping them through any one of these DEs or directly through the marketplace, that the client answers this question by saying, yes, somebody is helping me. And then you need to provide them with your FFM user ID and with your MPN number so that you're properly registered and that you're properly compensated for your services. That's what I want to emphasize on that one there. We have SEPs, special election periods. This is something that unfortunately, the way it has worked, it has lost some of its authority. Because initially, SEPs were very particular, very well defined. It was a very specific situation. But now we have SEPs all over the place. Anytime a hurricane comes, or anytime there is some type of situation, then they create a new SEP, and it has taken some of the order from the process. But there are certain valid SEPs. If somebody, what they call life events, somebody has a life event, for example, a newborn, or somebody dies in the family, or they get married, or they get divorced, they substantially change their income, or they move from one place to another. They were in California, now they come to Texas, etc. Then you have a very valid SEP. So you need to become aware of this SEP concept and all those different SEP categories, and make sure that you use them properly when they are valid. So again, become familiarized with the SEPs. And as I mentioned before, that we have had a situation because now they are appearing, they are creating so many new SEPs for so many different types of situations that it has lost part of its seriousness with those SEPs. We have this form, the 2024 ACA product review form. We strongly recommend that you download this form. It's also on our website where I show you. Download it. This is another place where I would start my conversation with my clients. What I would do is I start asking the question using the form that we show you, and then I start populating this form here with their full names and the date of birth and information on their current plan. Make sure that you cover their current plan, how much, what's the product name, what's the network name. Remember what I mentioned about the importance of the network, what's their PCP name, etc. So populate the current plan. That way you know exactly what they presently have, know exactly how much they're paying. Make sure you have all this information updated, the addresses. Remember that it's all about address and zip code, so that has to be accurate. Phone number, you need to make sure you have the right phone number so that you can contact these individuals. Everybody in the household with their full name and preferably their date of birth, because you're going to be needing that information. So this is a very effective form that I strongly recommend that you have a stack of them blank, and that as soon as you start your conversation, you take one of those federal poverty level chart brochures, and you take one of these and you start your conversation with them using this form. We strongly recommend that you get this form and that you start using it. Again, make sure that you follow all the guidelines and regulations associated with HIPAA laws, making sure you keep these forms in a safe place, and all the guidelines with regards to how to manage PII information. So with this, we get to the end of this initial session. As I mentioned to you at the beginning, we were going to be covering a lot of information. This is going to be in our TV channel, in our Roku channel, and also on our online channel. So you can go back and see it. And we're going to be conducting this for the next couple of months. But let me go through this final verification where I basically encompass everything we have seen today. Number one, make sure that you complete your certification and you look at yourself through the registration tracker, the process that I show you, where you see where everything is. You want to make sure you see all those green lights, all those green spots there. That means that you are properly certified to sell. That does not mean that you are ready to sell. You might be certified, but you still might make a sale and not get paid. Once you're certified, you need to confirm that you are ready to sell. That means that everything with the carriers is in place, so that when you make a sale, you get paid for it. If you are not ready to sell and you make a sale, they will not pay you that sale. So again, it's different from being certified. This is with the federal government. This is with the carrier. That and also includes the information from the federal government. Then make sure you have your ACA brochures with the federal 2024 federal poverty level chart, that you have banners, that you have all the materials that you need in order to be ready to start having a conversation with your client. Make sure you have your 2024 ACA product review on file, and make sure, and again, we're going to cover this in more detail in future trainings, all your consumer consent forms in place, ready for your clients to sign it. If you have all of this in place, I can guarantee you that you're going to be the right insurance agent. You're going to be able to fully satisfy your clients' needs. You're going to make sure that you put them in the right product based on their financial situation and their healthcare needs. You're going to put all of that into a mix, and you're going to come up with the right decision for them. Make sure you explain to them all aspects of the networks and the doctors and everything. And you should be having a very, very successful annual enrollment period. With that, we finish our presentation today. We have been answering questions as they have been coming through the questions tab. If there is something else that we haven't been able to answer, but you already asked it, we will make sure that we look at it and send you through an email the right information. If you have any issues with where you are in terms of the contracting, remember we represent all the major carriers in basically all 50 states. We're going to continue with these training sessions. Make sure that you tune in for each one of the different sessions. Each one of them is going to cover a different aspect of the whole comprehensive package that you need to make sure you go through in order to fully be able to manage your business. And we invite you, as soon as we finish here today, there is a survey. Please help us by properly answering that survey. That's going to help us get better at what we do, and that's going to help us align our training process to cater to your expectations and to your needs. Again, everybody, I'm Al Castellanos with Premier Insurance Contracts, and I want to thank you all for your presence with us today here. Thank you.